Namaskar. Good evening to all, and I welcome all to our today's webinar. I am Sharmishta Guha Majumdar, an intern with Pranashakti Foundation. I once again welcome all of you, and we are so grateful that you made the time to attend our webinar today. Today, it's a very fortunate day for us because we have Senior Vaidya, Dr. Madhava Diggavi sir with us. He is a person whose knowledge we cannot even think the depth of his knowledge. So this with his session we would be able to delve deeper in understanding diabetics on the principles, on the algorithms of Ayurveda, and and we are also eternally grateful to sir that he has allowed us to organize this event in midst of his busy schedule. We welcome you, sir, once again on our webinar today. Yes, sir. Sir, you can now
Thank you,
the
madam.
platform is yours, sir. Yeah.
Okay.
Yeah. Just one announcement is that I would request all the participants to keep themselves muted while the session is going on. Towards the end, you will have ample timing and
Good evening,
opportunity to
everyone.
ask your queries with sir. Yes. Thank you very much.
Welcome you all, respected Kunduji and respected Sharmishta madam, all the doctors, participants, delegates and friends. Ragadi Rogan Satatan Shaktan Aseshakaya Prasrtan Aseshan Outsukya Moha Ratidan Jaghana Yopurva Vaidyaya Namostu Tasme Deva Vaidyaya Vidmahe Dhanvantare Cha Dhimahi Tanno Deva Prachodayat. Pranashakti Foundation and all the members and my dear friends. It gives me an immense pleasure that we are here today to share something about the diabetes. Diabetes is a so very popular word in the market that even every layman can understand that it is a disease of lifetime and medicine should be consumed for lifetime. It is a common awareness in the market. Diabetes type 2 is a chronic disease. The main causative factors are improper diet, sedentary lifestyle, obesity, viral infection and inflammations, post-viral inflammatory cytokines, autoimmune disease. Sometimes it is beta cell dysfunction, and at last it is a genetic cause. The main issue in diabetes is insulin resistance and impaired insulin secretion. Two types of issues are there. Sometimes insulin is secreted, but in the cell it is not properly accepted and metabolized. Sometimes insulin is not secreted. Today I will not talk much about beta cell failure or insulin not secreted issues. We will talk more about insulin resistance and peripheral utilization of the insulin, cell metabolism, and all those issues. But the outcome of diabetes is where a medical practitioner comes into contact with the diabetes is due to the hyperglycemia. Hyperglycemia is a terminology which tells about increased sugar level in the blood. So the disease is focused on the values in the blood, and the sugar values or blood glucose values in the blood is the main criteria. It's a focus of either doctor or patient. The burden of diabetes is so high in the globally estimated that in 2019, 77 million individuals had diabetes in India, which is expected to rise over 134 million by 2045. It is also expected that 57% of these individuals remain undiagnosed. See, this is the area where we want to focus more. 57% of the individuals having hyperglycemia or type 2 diabetes are undiagnosed. So they will be accidentally diagnosed when they go to the doctor for some other purpose. Accidentally, blood sugar is checked and they will come to know that they have diabetes. In Ayurveda, we have similar terminologies for diabetes, and one such terminology is Madhumeha. Madhu means honey, Meha means excretion of urine. It is a clinical problem where patient passes excess urine, which is having sweet in taste, and it is having the characteristics similar to that of honey. The urine passed is like that of honey, so it is called Madhumeha. Of course, there are so many issues related to Prameha and Madhumeha, both are same or not. It is entirely literary issue. Madhumeha is a Tridosha Javadi. As per Ayurveda, Madhumeha is a disease born out of Vata, Pitta, Kapha, and all the three. All the three participate, and more dominant is Vata. Pitta and Kapha dosha are also participating. For me, Madhumeha is a terminology of a name of a disease, but it is a problem of Ama, Meda, Kleda, Dusti. It is a complex mechanism of Ama, Meda, and Kleda, Dusti. Actually, we are focusing more on this issue in this aspect that we are able to treat this. If anybody asks what is a drug for Madhumeha, we have limitation. But the on undergoing Samprapti platform of Rakta Dusti. For me, Madhumeha or diabetes it is expressed in the form of platform of Rakta Dusti, explained in the context of Vidhi Shoniti Adhyaya of Acharya Charaka Samhita. It is a clinical phase to understand curable hyperglycemia or treatable hyperglycemia or controllable hyperglycemia. I repeat, if we are able to understand a patient of Madhumeha coming to us telling his problems in a platform of Rakta Dusti and Ama Meda Kleta Dusti, then we are able to give some solutions with Ayurvedic perspective, because at this clinical phase, the patient is curable hyperglycemia, he is treatable hyperglycemia, or it is controllable hyperglycemia. Once this clinical phase is crossed, then he becomes only manageable hyperglycemia. Lifetime we have to give medicine, then it becomes a manageable hyperglycemia case. In modern textbooks and literature, if you go through, it is a multi-organ involvement complications. Type 2 diabetes is not one single organ disease or a dysfunction. It is a multi-organ complex syndrome. It is a multi-organ complex syndrome with many complications. With medicine, complications will rise. Without medicine, no doubt there will be multi-organ complications will rise. This is the main drawback of the disease, that why globally we are bothered about type 2 diabetes in general is, with medicine also the complications will start continued. Broadly, type 2 diabetes is divided into two aspects. One is microvascular complications of diabetes type 2. Another is macrovascular complications of type 2 diabetes. These complications are very significant because it is estimated that in our human body, if you take out all the arteries and veins and join globe once at all, so that much of long vascular structure is there in the body, and they are having a big network. And if this macrovascular and microvascular damage starts, this morbidity and mortality among the individuals with diabetes is very high. So we have to understand hyperglycemia as one clinical phase. Ama Meda Kapha Kleda Dusti is another phase, and microvascular and macrovascular complications in another phase. So today I will present my practice and my experience in 3 or 4 concepts, 4 principles, because there are innumerable ways or innumerable infinite ways to explain diabetes. But in one schedule of one webinar, we cannot touch all the issues, and it will be a gambling and it is difficult to understand to the followers. So I'll make clear about 3 concepts or 4 concepts, and remaining things I'll just touch. Actually, diabetes needs a series of webinars to explain many concepts of practice, many principles of practice. If anybody asks me, sir, tell me one medicine for diabetes, no, I cannot tell very easily, because it is a tailor-made, individual specific, personalized solution given by considering so many issues and aspects. Every drug will not be effective in every patient, and the same drug in the same dose is not effective to all patients. For example, metformin 500 may be enough for one patient, but metformin 1.5 grams per day is also not effective for some of the patients. So in this way, in first concept, I'll talk about Rakta Dushti as one of the principle for practice of Madhumeha. In this slide, you can see one upper part is and low. The first concept of Dushti. See, a modern doctor is based on not the symptoms alone. Polydipsia, polyuria, polyphasia is not practical things now. They are outdated pictures. Now in my OPD, if I see 10 cases in one OPD, all will not tell about Prabhu Tavila Mutrata as one of the complaint. Now they are following the diet, they are going to yoga sessions, they are going for a walking session, they are going for a dhyana session, they are going for detox programs, they are taking online diet schedules. So their doctor is telling some concepts of management. Somebody will go to the bitter juices drinking, somebody will go to the bitter tablets taking. So like this, so many practices are there in the market, but every practicing doctor of medicine will diagnose the patient of Madhumeha based on the blood report. The blood test is one of the important marker for every practicing doctor, and based on blood report only we will decide. Patient may tell 10 problems in front of the doctor, but doctor will think about only what is the fasting sugar, what is the postprandial sugar, what is the glycated hemoglobin levels or lipid profile. That's all. In the view of doctor, the prescription is based on fasting and postprandial sugar, but patient will tell 10 issues. He may be having peripheral neuropathy, patient is having burning sensation in the feet and the hands, but patient is having sometimes increased thirst. Sometimes patient tells, nowadays whatever patient comes to the OPD, he will tell that he is having massive weakness, fatigability. Sometimes patient says weight loss, sometimes patient says body pains. I have noticed wherever there is a diabetes patient, his right shoulder or left shoulder joint is very common. Diabetes patient definitely will develop one or another day shoulder joint pain. We have noticed that most of the diabetes patient will suffer with shoulder pain. So shoulder pain may not be always due to diabetes, but most of the diabetes patient will suffer with shoulder joint pain. Nowadays, I am seeing diabetic arthropathy cases where multiple joint pain is one of the common feature of diabetes patient. I am also witnessing many cases coming to the OPD and telling body pains, muscular pains. Fibromyalgia is one of the presentation. So if fibromyalgia is there, if you give painkiller, it is not treatment for diabetes. So then I start thinking, whenever patient comes to us, let us think about Rakta Dushti platform. Dear friends, as a participant or a delegate, you can also follow this, or as a treating practitioner or a Vaidya, you can also think about this. I'll give one example. Pipasa is thirst. It is one of the Rakta Dushti Lakshana. And this increased thirst and dryness on modern literature. It is very worth to notice this. Hyperglycemia shows increased thirst and dryness of the mouth as a symptom. Ayurveda says this dryness of the mouth or increased thirst is Pipasa, and it is one of the Rakta Dushti Lakshana. It may not be a direct symptom of diabetes, but it is a symptom of Rakta Dushti Lakshana for me. This is a new approach and new principle from my side, from my OPD, from my OPD. you can think like this. Madhava shows of oral cavity, the tongue, palate, and pharynx. Oropharynx will have dryness. This is one of the Pura Rupa of Madhumeha, prodromal symptom or early symptomatology of Madhumeha. And if you see in diabetes, increased thirst and dryness of the mouth is also enlisted in modern literature as Lakshana of type 2 diabetes. So for me, this pipasa, increased thirst and dryness mouth is Raktadushti Lakshana. It is also hyperglycemia Lakshana. It is one of the Pura Rupa of Madhumeha. So it is a type of diabetes Lakshana. So my concept is this symptom is due to the Pitta Dosha Pradhana Lakshana. So Virechana is one of the best line of Shodhana Chikitsa for this Pitta Dosha Pradhana Avastha. If you want to give Pitta Prashamana Chikitsa like Chitraka, Vatsanaba, Tulasi, are the immunomodulators and rasayana drugs which can help in this pipasa lakshana, which is pitta pradhana avastha. Virechana followed by vatsanaba. Vatsanaba is one of a potent drug, alkaloid drug used in the Trishna lakshana. So this vatsanaba, chitraka, tulasi, sariva chatushka, and paranini chatushka. Chatushparani drugs like or parpata ushira, musta, shadanga paniya. All these are our choices of treatment in diabetes mellitus when patient comes with a presentation of rakta dushti lakshana like pipasa. At the same time, rakta prameha is one of the rakta dushti lakshana, polyuria or abhisarana on mutra, pipilika abhisarana on mutra. Frequent urination is a symptom of type 2 diabetes. It is also due to the pitta vruddhi lakshana. Their Chandra Prabhavati, Gokshuradi Gugulu, Haridra Khanda are one of the choice to be understood, and Manjishta Ganavati may be one of the drug, or even Pashana Beda Ganavati may be one of the drug. Pashana Beda the Kwata Churna can also be used. Tandra is one of the Rakta Dushti Lakshana. It is a blurred vision, and Tandra is also one of the Lakshana of Pura Rupa. So blurred patient awareness of even he had to watch, then his must is one of the choice for the Dushti Lakshana. Daurbalya is tiredness. Unintentional weight loss is also going to cause Daurbalya. Alasya and Daurbalya are Madhumeha Pura Rupa Lakshanas. Fatigue and unintended weight loss is also a symptom of type 2 diabetes. This is also Pitta Pradhana Avastha, wherein Shilajitu, Tamra Basma, Yashada Basma, Kalpas. Either you can use Shilajitu as a single drug with 5 gram 2 times a day dose, Tamra Basma 125 milligram or 62 milligram per dose, and Yashada Basma 125 milligram dose. As a treatment for Daurbalya, Jasada Basma is told in Ayurveda Rasaushadhi textbooks as Madhumehara Pramehahara, but it is also one of the best drug for Rakta Dushti Lakshana like Durbalya. Shatpada Pipilika Parisaranam is one of the Rakta Dushti Lakshana, and it can also be seen in Madhumeha Pura Rupa, and also it is numbness and tingling sensation in the hands and feet, where Vidanga Tandula Rasayana, Nimba Panchanga Rasayana, Khadira Rasayana. It is also told in text that if you cook your food, or a diabetic person's food should be cooked in Khadira Kastam, then Madhumeha is very well treated. In another presentation, one of my principle is if Charmadala, Kushta, Kandu, Kota, Pidit infection and dermatological. Actually, patient came in, we diagnose infections such as bladder infections, cystitis, skin infections. Slow healing sores and frequent infection is a symptom of type 2 diabetes mellitus. It is a kapha pradhana avastha. So principle is changed. Earlierly, we used to tell about Pitta Pradhana Avastha and Virechana Chikitsa. These are all Kapha Pradhana Lakshanas in Rakta Dushti Lakshana and hyperglycemia Lakshana, Madhumeha Pura Rupa Lakshana or type 2 diabetes Lakshana. Then Vamana followed by Vidanga Tandula Rasayana, Nimba Panchanga Rasayana, Nimba Twak Rasayana. Such drugs are to be prescribed, and one of the best molecule we prescribe is Aragyavardhini, where Nimba is high in the concentration of this Rakta Dushti Lakshana, And Mustadi Pachana Kashayam or Mustadi Gana Kashayam is one of the treatment we can prescribe. Or even Nimbadi Kashayam, Panchatikta Kashayam, Mahatikta Kashayam can be prescribed when patient is having Svedadikya as one of the Rakta Dushti Lakshana and Madhumeha Lakshana. Sharira Daurgandhya, a bad odor in the whole body or urine of the patient can be taken as Visra Sharira Gandha is Purva Rupa of Madhumeha. There, Chitraka, Pippali, Kataka, Kadiradi Kashayam can be prescribed. Puti Grana, patient feels bad odor and it is also Kapha Pradhana Avastha. There Vamana followed by Chitraka, Pippali, Amalaki, Tulasi. These sort of drugs are kalpas of Chitraka like Chitrakadivati, Chitrakasavam, Chitraka Grantyadi Kashayam in Ashtanga Hridayam. Amalaki Amalakyadi Kashayam, Amalaki Grutam. Tulasi Asavam, Tulasi Kalpam, Tulasi Ganavati. All these are our choice of prescription. Anidrata is one of the Rashti Lakshana, and Shavya patient is always lying on the bed, and Swapna Sukherati. These are all the Purva Rupa of Madhumeha Lakshana. It is also one of the Kapha Pradhana Avastha of Madhumeha and Rakta Dushti Lakshana. Their Vamana followed by Jyotishmati and Haridra Rasayana. Jyotishmati is a powerful major Rasayana. It is effective in Atinidra Avastha of Kapha Pradhana, Madhumeha Lakshana and Rakta Dushti Lakshanas. In the same way, Guru Gatrata, heaviness in the body feels very heavy. This is one of the Purva Rupa of Madhumeha. It is also Kapha Pradhana Avastha of Madhumeha and Rakta Dushti Lakshana. There Trifala Rasayana. That's why in Charaka Sutra Sthana, Trifala Kashayam, Falatrikadi Kashayam in Chikitsa Sthana is told. Lodradi Kashayam and Lodrasavam from Charaka Samhita can be prescribed when patient is having Guru Gatrata. Vidanga Tandula Rasayanam and Pippali, Chatushashta Pippali Rasayanam, Pippali Adi Leham, Pippali Rasayanam, Pippali Kashayam, Vardhamana Pippali Rasayanam. Like this, in my concept, these concept-based, Raktadushti concept-based understanding of hyperglycemia is better practice. And once patient lands up in diabetes, it is already Kashta Sadhya Avastha or Asadhya Avastha and Pratyakheya. If you are able to diagnose Rakta Dushti Lakshana Avastha of a Madhumeha Rogi, then it is very Sukhasadhya Avastha of Chikitsa for Ayurvedic physician. So prevention is better than cure. Madhumeha Lakshana can be diagnosed as Rakta Dushti Lakshana in early symptoms of patient coming without diagnosis of diabetes by modern doctor. But we can think about family history of diabetes, parental diabetic history. If you think about Rakta Dushti Lakshana evaluation in clinical practice, complete remission like treatment. I'll go to the importance of calcium ion in diabetes management. Calcium is a need for secretion of insulin. See, in the picture you can see, if calcium ions are going inside the beta cell, the calcium ion will activate insulin gene, insulin producing gene. Then insulin from the nucleus is activated, secreted, liberated in the cell, and insulin production goes out of the cell. So this is in a Anu or in a Srotas or in a Paramanu, what activity is going on is taught by modern science. So low level of calcium decreases the secretion of insulin. For Padartha Vijnana students of Ayurveda, this is an inversely proportional relation. Where calcium levels are decreased, their insulin secretion is decreased. If calcium ion is very good in quantity, secretion of the insulin from the beta cell takes place well. Calcium ion activities are similar to Vata dosha. Treatment should be Shodhana followed by Rasayana. When calcium ion is, if you go to the patient of treatment and want to treat calcium based treatment, check the serum calcium level and also ionized calcium level in the blood. And if in the blood calcium ion is less, do Shodhana Chikitsa. Virechana is one of the important level of Chikitsa because the extracellular component may be having calcium, but blood will not be having serum calcium level normal. This is one of the Vikriti in patient. Give Shodhana Chikitsa like Virechana Karma, and followed by that, you have to give a selection of drug like Shodhita Chitraka, Shuddha Chitraka. Chitraka Shodhana is done by calcium carbonate water. So that is having calcium ion tagged with the Chitraka molecule. So Chitraka contains lead and it is purified with calcium carbonate water. So this Shuddha Chitraka will have activation of calcium molecule and calcium secretion takes place. Sravanat Srotamsi is one of the given to the Srotas. So beta cell Srotas will be Rasayanam, Vatsanabha. Vatsanabha is the starts. And Svedana takes place by Vatsanabha administration. So Sveda Janaka and Pravruti effect of Vatsanabha is there. Of course, it may be a Visharasayana, Vishavargiya Dravya, but Shodhita Vatsanabha definitely enhance the release of insulin molecule from the beta cell, and it can also enhance the input of insulin into the cell. Both will be done by Vatsanabha Rasayana. In Ayurveda Shastra, Vatsanabha Vati is available. Vatsanabha Kalpas are available like Tribhuvana Kirti Rasayana. So many Vatsanabha Kalpas are there, or either the secretion of insulin by beta cell with the help of calcium ion activation. Tarakeshwara Rasa is one of the complex Ayurvedic Rasauchadi that is going to help the release of insulin molecule from the cell. Exposure to sunlight between 11 a.m. to 3 p.m. is a good time to enhance the calcium metabolism and vitamin D3 synthesis by the skin. So for normal functioning of the calcium, exposure to sunlight is important. This is one of the vihara, it is one of the counseling should be done to the patient that they should have some half an hour exposure to the sunlight in the day. Tambula Sevana, a classical practice of Tambula Sevana, it contains 16 ingredients for a Tambula, where calcium carbonate is one of the ingredient of Tambula. So we know that after a very good feast, whether it is a Bengali sweet feast or a lunch with a lot of South Indian sweets, we take Pan Bida or Tambula Sevanam is told in Ayurveda. In Dinacharya also Tambula Sevana is told. If Tambula Sevana is taken, a mild amount of calcium directly goes to the body, and that's why patient will have calcium activation and insulin secretion will be more when patient is having high glucose diet or high understood by Ayurveda doctor and practitioner to practice Madhumeha. Glucose transporter mechanism is one of the important aspects of Madhumeha Chikitsa. Glucose transporters are a wide group of membrane proteins that facilitate the transport of glucose across the plasma membrane of a cell. Glucose which is present in the blood should digest by entering into the cell membrane, and this mechanism of transport of glucose from bloodstream to the cell is carried by the Dhatvagnipaka glucose transporter mechanism. This can be understood as the function of Vyanavata, Samanavata, Panchavata Karma, Pachaka Pitta Karma, Kledaka Kapha Karma, and Dhatvagni Vyapara. So Dhatvagni Vyapara of Ayurveda very well matches with Vyanavayu Karma and glucose transporter mechanism, and by this the Dhatvagni Vyapara can be improved in the patient of diabetes mellitus. In modern science, there are 5 glucose transporters, glucose transporter 1, 2, 3, 4, 5. So glucose transporter 1, it is present in all human tissues. So all tissues have got the glucose transporter number 1. And this is having a high affinity, and basal glucose uptake is improved by glucose transporter 1. Central nervous system also gets more activation by glucose transporter 1. Blood vessels have got the glucose transporter 1 affinity and activity. So blood vessels, nervous system, and even having all high body immune tissues, glucose transporter, if it is good, there will be good mechanism of glucose transporter into the cell, and there will be digestion and metabolism of the starch, carbohydrate, and fat. If glucose transporter 1 is abnormal, then patient will have diabetes. In this category, Amalaki and Haridra are very effective drugs. So Nishamalaki Prayogam. See, Amalaki is Shitavirya, Haridra is Ushnavirya. Combination of Shitavirya and Ushnavirya drug is told by Ayurveda. This is one of the Vichitra Pratyarabdha Rasayana Kalpa in Ayurveda. In case of glucose transporter mechanism vikaras, Amalaki Rasayanam, Amalaki Bhavita Amalaki Ganavati, Amalaki Ganavati, Amalaki Kashayam, Amalakyadi Kashayam, Haridra Amalaki Yogam, Nishamalaki Rasayanam, Nimma Nishamalaki Kalpam. All these are effective, and one of the clinical trial has been done by glucose polyphenolic extract. In this additional track has been taken by modern Tinospora cardifolia. Guduchi is also worked in some of the clinical trials have reported that Guduchi, Amalaki, and Haridra have got a potent action. Curcumin also is having a potent action on glucose transporter 1. Curcumin directly inhibits the transport activity of glucose transporter 1. And in International Journal of Ayurveda, Pharmacological Research, an article has published in vitro cytotoxic glucose activity of Siddha formulation. Cell line study has been done. So these many research works have supported that glucose transporter 1 mechanism is to be understood by Ayurvedic practitioner. Based on this principle, we can select rasayanas like Guduchi, Haridra, Amalaki. Glucose transporter 2, it is very rich in beta cells. It is also rich in liver organ. It is having low affinity. Whereas glucose transporter 1 is having high affinity. Glucose transporter 2 is having low affinity. Postprandial action is very good in glucose 2 transporter. So glucose transporter in beta cell activity. So it is having phytosteroids which will stimulate glucose transporter 2. Glucose transporter 3, it is present in all tissues, major transporter in the neurons of central nervous system. When central nervous system activities are affected by diabetes, vata pradhana madhumeha or vataja madhumeha, in that case where glucose transporter 3 is affected, we have to use amalak, duchi, jambu bija churna, chitrakan pippali, katu ushna rasayana. If you see Vatavyadi Adhyaya of Ashtanga Hridaya, Chitraka Rasayana, Chitraka Mula Rasayana is told by Acharya Vagbata for Vatavyadis. Chitraka Mula with Sacharadi Tailam is told. So like that, glucose transporter 3 is present in major transportation of neurons in central nervous system. When Vata Pradhana and Madhumeha is there, their Chitraka Pippali Jambu Bija Kalpas can be taken for the practice of Madhumeha Rogi. Glucose transporter 4 is present in skeletal muscles. Skeletal muscles are furnaces of insulin metabolism, glucose metabolism. They are also present in fat cells, and insulin stimulates the translocation from cytosol to the cell membranes. So glucose transporter 4 is Agnimandya Vikara. In the Mamsagata Agnimandya, Mamsa is one of the important tissue for the metabolism of glucose and insulin. If Mamsa metabolism is upset, or Mamsa Dhatvagni Vyapara is upset, then patient will suffer with muscle pains, muscle tiredness, and low motor activity, and Karapada Daha, and Daurbalya, and fatigue. In such case, Tamra-based kalpas, Tamra-based kalpas, Pippali Chitraka kalpas, Loha Basma kalpas, and even Abraka kalpas are very effective. Glucose transporter 5, it is present in breast borders of intestinal cells. So that's why I strongly suggest that one of the Shodhana Chikitsa must be done before the startment or commencement of any Rasayana Aushadhis of Ayurveda. That will there will be coating of the intestinal mucous membrane. If that coating is removed by Virechana Karma, Shodhana Chikitsa, followed by that glucose transporter 5, improving rasayanas like Loha Basma, Abraka Basma, Pippali Rasayana, and Arogyavardhini Vati, they are primarily acting on transports of fructose. The liver and when patient of spermatozoa is affected, the transports of fructose is affected. That's why whenever we do in Vajikarana Chikitsa, serum fructose level is estimated in Shukradhatu. Semen analysis of fructose tells that spermatogenesis is present in this germinal epithelium of the testis. So glucose transporter 5 tells about spermatozoa and primarily transportation of fructose in the body. So Abrakavasma is very effective Pragna Bodhi drug which will affect the Shukradhatu. It is effective in enhancing the metabolism of glucose 5 transporter mechanisms. So fructose mechanism is improved by glucose transporter 5. So based on glucose transporter 1, 2, 3, 4, 5, a Ayurvedic doctor can start his Ayurvedic practice on Madhumeha. So I will come to the third concept. The third concept in diabetes management is stress and hyperglycemia. Cytokines and hepatokines, TNF alpha, interleukin 6 and interleukin 1, FOXO genes, they are very important in insulin resistance. Insulin resistance is Kafameda Savrtavata, Kafavrtavata, or Anavrtavata, Amavrtavata, and it is Malavrtavata. These avarana pragna must be there for a Ayurvedic practitioner, and simply giving one roga and one yoga. For diabetes, if they give one yoga and if patient is not improved, they cannot blame that Ayurvedic drug is not good and allopathy drug is good. We have to understand the inflammatory markers like cytokines and hepatokines, which are going to cause avarana upon the insulin metabolism in the body, where there is syndrome X and stula pramehi, and where obese diabetes are there. They normally, after 2019 onwards, we all the modern doctors started investigating inflammatory markers like interleukin 1, interleukin 6, and these are all inflammatory markers, and these inflammatory markers are also rich in diabetes resistance is due to avarana in the cell. So if avarana should be removed, then kafagnam, vamanam, virachanam, and katu ushna rasayana should be selected. So during stressful situations, epinephrine, adrenaline, glucagon, growth hormone, and cortisol play a very important role. Due to these stress hormones, blood sugar level rises. In spite of allopathy drug, in spite of insulin injection, in spite of Ayurvedic rasayanas, blood sugar will not be controlled. It is due to the because of the stress and hyperglycemia axis. So stressful situations include infections, serious illness, or significant emotional stress. Even infection is a stress on the body. Infection causes kidney infections and urinary tract infections. So Prabhuta Avila Mutrata increases. They will not respond to single Ayurvedic drug for diabetes alone. Then we should think about inflammatory markers and decrease the inflammatory markers by curcumin or even Brahma Rasayanam or Amalaki Rasayanam, Abhayamalaki Rasayanam, Shotahara Rasayana like Punarnavadi Mandura, Tapyadi Lohavati, and Neelakanta Rasa like Shotahara drugs are very effective. Kamsa Haritaki, Dashamula Haritaki, such drugs, when we use, they are going to decline this cytokine storm or hepatokine storm, and they reduce the insulin resistance, and patient will be better. Stress can be reduced by Sarvanga Abhyanga, Sarvanga Dhara, Dhanyamla Dhara, Shiro Dhara with Kwata, Shiro Dhara with Takra. In patient to decrease the kleda and avarana, takradara, dhanyamla dhara are very effective. Sarvanga dhara, rekanga dhara can be practiced. Hormones are affected in the stress level. When stress is increased, glucagon, growth hormone, cortisol, and catecholamines will be raised. Catecholamines is vata, growth hormone is kapha, cortisol is kapha, glucagon is also kapha. So this is kaphavrita vata, medhavrita vata, annavrita vata, amavrita vata, and vishavrita vata. So increased gluconeogenesis takes place by the liver because liver gets upset by these stress hormones. Then also, when stressed, the body prepares itself for ensuring that enough sugar or energy is ready for available. During the stress, we become very fatigued. When catecholamines are reached, when we get kama, shoka, bhaya, krodha, we get weakness. So ready glucose is required. So liver will release more glucose to the blood, and then there will be hyperglycemia. If this is a temporary phenomena after kama, shoka, bhaya, krodha, and stress, if the stress comes back and glucose comes down, it is not a problem. After the stress, if there is irreversible gluconeogenesis is there into the blood, then patient is diagnosed as stress-induced diabetes, and regular the previous concepts will not work. Many of the good rasayanas will not work. At the same time, growth hormone and cortisol levels rise, which causes body tissues, muscle and fat to be less sensitive to the insulin. When kama, shoka, bhaya, krodha, stress are there, or arishad vargas are affecting the patient, bhaya is there, trasa is there, then patient's sensitivity to insulin will be reduced in muscle and fat. Mamsa dhatu and medo dhatu will get affected by avrana samprapti, and then stula pramehi will develop, and in stula pramehi, regular amalaki rasayana, nishamalaki rasayana will not work. Even metformin will not work. Metformin dose will be loaded to 1.5 gram per day, and that will cause fatty liver because that fat which is not digested by the insulin will be stored in the liver, and then we get metformin induced fatty liver or metformin induced fatty liver deposition and steatohepatitis. This is a new generation problem. Drug induced fatty liver is a big issue in the market. All diabetic patients with stress are getting muscle and fat disorders, and in the fatty liver manifestation, this is one of the important aspects. So we have to manage increased insulin resistance once again. Avaranagnam, Vatanulomanam, Katu Ushna Tikta Rasayanam should be planned, and for that purpose, again, Rakta Dhatu Dushti level treatment is to be planned. There is one more stress phenomenon I want to talk about, the Somogi phenomenon. And the Somogi phenomenon, where in early morning 3 to 4 a.m. or 3 to 6 a.m., hypoglycemia may develop due to the excess administration of insulin at night level. But again, at the morning around 6 to 7 a.m., there will be hyperglycemia. Hypoglycemia followed by hyperglycemia is a Somogi phenomenon. When blood glucose level falls below normal, the body responds by releasing more endocrine hormones like glucagon, as well as stress hormones, epinephrine, cortisol, and growth hormone. Due to this, there will be hyperglycemia in the bloodstream. So glucagon facilitates release of glucose from the liver cells that raises the blood glucose immediately, and the stress hormones cause insulin resistance for several hours, sustaining the elevated blood sugar. That's why patient will have fasting blood sugar will be raised, and patient will have morning giddiness, morning weakness, fatigability, unable to do yoga, exercise, or morning get up. Patient will not be able to get up early in the morning due to this hyperglycemia or Somogi phenomenon. So night dose of insulin or night dose of Ayurvedic drug or night dose of metformin should be always connected to liver metabolism. You give Yakrut Rasayanas, Yakrut Balya Rasayanas, Yakrut Uttejak Rasayanas, or Yakrut Vishahara Rasayanas. Dawn phenomena is also one of the stress phenomena, wherein the dawn phenomenon refers to periodic episodes of hyperglycemia experienced by patients with diabetes in the early morning. Early morning hyperglycemia at 2 to 4 a.m. It is a Brahmi Muhurte Uttishte Swasto Rakshayirta Maisha. If you develop hyperglycemia, patient will get up early, in the midnight and will have trishna and giddiness and hyperglycemia symptoms. That's why in the Brahma Muhurta at the 3:30 to 4:30 a.m. if you get up, at hyperglycemia time, patient is alert. So hyperglycemia can be managed by the patient by increased muscular activities or increased physical activity in the early morning. Exposure to the early sunlight will make this early morning hyperglycemia treated. That's why Ayurveda Dinacharya says, Brahme Muhurte Uttishtet. 2 hours before the Arunodaya, that is almost 3:30 to 4 a.m. is one of the time where hyperglycemia is happening. This is dawn phenomenon. Normal blood sugar level at the bedtime, when normal glucose sugar level in the overnight, and suddenly there will be a high blood sugar level early in the morning 2:30 to 4:30 level or 2 to 3 a.m. So due to low dose of administration of insulin, or the dawn phenomenon happens to nearby everyone with diabetes. So every patient says that at 2 o'clock I get up for urination, somebody will get giddiness and fall down. They will have head injury or cerebrovascular accident or pakshagata. Some of the patient get up early morning in the 3 o'clock and he suddenly gets up with a fear of trishna, and they will develop tachycardia and cardiac MI. So late night MI is due to the dawn effect also. So a Somogi effect is normal blood sugar level at bedtime. In both group, there is bedtime blood sugar level is normal, but overnight in the dawn phenomenon, blood sugar level is normal. But in Somogi effect, you can see in the curve, there will be sudden decrease in the blood sugar level in the overnight, and patient will have blood sugar level rise in the early morning. So this decrease and increase of blood sugar level is taking place according to the Vata Pitta Kafas. If you can understand, Ahoratradi Bhaktanam Te Ante Madhyadiga Kramat. In the day and night, Vata Pitta Kapha times are adjusted. This is a nocturnal rhythm given by the god, and even according to the Ritu, according to the day, according to the night, Vata Pitta Kapha predominance time is told. So dawn phenomenon and Somogi effect are stress-based diabetes management, and every doctor should understand. With this, I come to the management of hyperglycemia. If hyperglycemia is not responding to any of the treatment, then focus on stress management. Give management to see. I always suppose to tell that all my students and practitioners, I want to tell important thing. In Ayurveda, three pillars are told for chikitsa. Chikitsam Trividam. Daiva Vyapashrayam, Yukti Vyapashrayam, and Sattvayajam. Out of three pillars, we are using only Yukti Vyapashraya Chikitsa. Yukti Vyapashraya Chikitsa includes Anta Parimarjana, Bhai Parimarjana, Shastra Pranidhana, and Shodhana and Shamana Chikitsa. But we are forgetting Daiva Vyapashraya Chikitsa and Sattvayajaya Chikitsa. Out of Kaya Chikitsa, we have two pillars we are forgetting, and we are thinking about only Shodhana Shamana Chikitsa, Abhyantara Chikitsa, Bahya Chikitsa. So we are doing 66% of treatment is lost. Only 33% we are trying. Out of 33%, we are doing treatment only Yukti Vyapashraya Chikitsa. Sometimes we give only Shamana Chikitsa. People are fond of giving only one tablet, one kashayam, or one churnam. and we give only Tikta Skanda Aushadhis, all bitter principles we give, and Tikta Rasa increases Vata dosha in long run. So patient of Stula Pramehi is converted into Krusha Pramehi because of Tikta Rasa Ati Yoga. Tikta Rasa Ati Yoga causes Shoninta Dushti, and also patient will become thin, Krusha, and then Sambrahmanam Tatra Krushasya Karyam, Samshodhanam Dosha Baladikasya will be a problem to adopt. So Shirodhara, Shirotalam, Shiropichu, and Nasya Karmas, made the Rasayana Karmas are best choice of treatment when patient is having stress-borne Somogi effect or Dawn effect induced stress-borne Vata Pitta Kapha Dushti and Rakta Dushti and causing diabetes type 2. So Medya Chatushka Rasayana. What Acharya Charaka says about Yashtimadu, Mandukaparani, Vacha, and Brahmi, these Shankapushpi, these Medya Chatushka Rasayana, we are doing trials on these Medya Chatushka Vati. One of my PG scholar, Dr. Bhargava, has worked on this Medya Chatushka Vati on different stress-borne diseases and central nervous system disorders. So the same Medya Chatushka Vati or Medya Chatushka Kashayam, Medya Chatushka Churnam should be taken for clinical study where stress hormones are more. In one of our study, in research study, Dr. Narsareddy et al., where we have noticed that very powerful rasayana is effective in some of the patients of diabetes where stress is not the cause. There, our Neelakanta Rasa and Rasayana is very effective. Abhaya Kashayam, Abhayadi Kashayam, and Neelakanta Rasayanam, and Falatrikadi Kashayam is working out very well. If patient is having high stress levels, then drug effect is not very much appreciated. Then we have proposed the same to the further studies, and in Nayak et al., we are taking stress management as one of the treatment for diabetes patients type 2. So, Medha Chatushka, it is also worked out for Alzheimer's disease and type 2 diabetes. Nowadays, new research is coming. Type 2 diabetes induced Alzheimer's disease. See, at 60 years, Alzheimer's disease is common. But at 35 to 40, when patient is having diabetes, diabetes is causing Alzheimer's disease type 2. The AMA is one of the cause for tau proteins blocking the neuron network is a cause for type 2 diabetes, Alzheimer's disease. In Alzheimer's disease, one more condition is noticed that the loading of Loha is also going to cause the block in the neuronal network. Medha Chatushka Rasayanas and Jyotishmati Rasayanas are very effective in reversing these tau protein blocks or Loha loading blocks in the management of Alzheimer's disease due to the type 2 diabetes is one of the new area where we should thinking about Medha Rasayana or Unmada Bhairava Rasa like Rasayana should be used for Alzheimer's disease and diabetes. It is also noticed that type 2 diabetes causes brain insulin resistance is linked to the neuronal dysfunction and cognitive impairment of Alzheimer's dementia. So actually, insulin metabolism is a Dhatvagni Vikara, Samana Vayu, Vyana Vayu, and Prana Vayu Vikara. So Prana, Vyana, Samana axis is affected in stress-borne hormone disorders. So psychoneuroimmunoendocrinal axis regulation is very important in the management of type 2 diabetes. So the responsibility of a diabetes physician is more that he should also address the psychological component by Sattva-Vajaya Chikitsa, Medha Rasayana Chikitsa, Achara Rasayana Chikitsa, and Brahma Rasayana or the Rasayana Chikitsa or Abraka Rasayana, which is one of the Sangna Prabodhi drug. Such drugs should be used, and even some of the rasayanas like Abraka Basma, Kuchala Rasayanas, Sanjeevani Vati. In one of the clinical trial, it is observed that Dr. Narsa Reddy et al., we have noticed and documented that Sanjeevani Vati is having a tremendous Deepana, Pachana, Amadoshahara, Sruto Shodhana effect and hyperglycemia reducing effect and also Rasayana effect in the management of type 2 diabetes. It is Kafamedahara, Avaranagnam, Vatanulomanam, Dhatvagni Deepanam because of Bhallataka and Vatsanaba, both Visha Rasayanas are present in this Sanjeevani Vati. So we can also think about stress-borne disorders, hormone-borne disorders in the management of Madhumeha. I will, in short, quote some of the principles. If I don't touch these things, people will think that diabetes presentation is incomplete. But I will not go into the depth of these issues. Like major complications of diabetes is divided into two types: microvascular complication and macrovascular complications. The disorder of the brain increases the risk of stroke, pakshagata, cerebrovascular diseases, including transient ischemic attack and cognitive impairment, like Alzheimer's disease is very common due to the diabetes macrovascular complications. high blood pressure and insulin resistance in coronary and ischemic heart diseases. So if you fail in the management of drug addiction, and if you fail in the management of Raktadushti and also Madhumeha Chikitsa is failed, then such patients have macrovascular or non-healing ulcers and wounds. Peripheral vascular disease is due to the macrovascular complications of diabetes that should also be addressed by Madhumeha Chikitsa person. Microvascular damages include eye disorders, high blood pressure, high blood glucose, and the damage to the eye blood vessels, retinal vessels causes, ocular artery causes retinopathy, and also glaucoma and cataracts. In this way, Chakshusha Rasayana should be started, make the Rasayana should be started along with diabetes care. So kidney damage, high blood pressure, high hyperglycemia, damage the small blood vessels and excess blood glucose overworks the kidneys. Kidney will be having a workload because of the over glucose in the blood. So the blood filtering mechanism of the nephron is damaged. Nephron will have shrinking effect, or nephron will have leakage of protein effect. Then proteinuria, microalbuminuria, and nephrosclerosis will develop. And the diabetic kidney disorder, diabetic nephropathy, diabetes induced CKD is very high in the market, where our own doctors are not able to control in the early stages of Kriya Kala. Then neuropathy. Neuropathy is a big area where hyperglycemia damages nerves in the peripheral nervous system. This may result in pain or numbness in the periphery. So feet wounds may also go undetected or got infected and lead to the gangrene. In this way, major complication of diabetes is microvascular and macrovascular. I may take a separate session for developing Ayurvedic principal treatments in coming episodes. Snehapana is one of the important aspects of Shodhana Chikitsa in diabetes management. According to Charaka, the three Kantakadya Taila, which is going to be effective in Vataja, Kafaja, and Vata Kafaja Prameha. These three Kantakadya Taila can be taken, where Taila base can be either Tila Taila or Sarshapa Taila should be used for Taila Paka. In Pittaja Prameha, Grita prepared from the same Kalka and Kwata is used. In Tridoshaja Avastha, Yamaka Sneha, Gruta and Taila mixed Sneha should be used. According to Sushruta, Priyangwadi Siddha Gruta and Taila or Yamaka Sneha can be used. Dhanvantara Gruta is one of the best Snehapana. Please, practitioners, note this. Along with Madhumeha Chikitsa, if Amadosha is not there, Dhatvagni Mandya is not there, the patient symptoms specific one of them either as Shamanang, Sushruta, Nikma, Ingmeha Avastha. According to Vagbata, Sarshapa, Nimba, Nikumba, Bibitaka Taila, Karanja Taila, and three Kantakadi Taila are told for Snehapana. In the low dose, the Sarshapa Taila, we have noticed in Dr. Narsa Reddy et al. In one of the PG research, we have taken Sarshapa Taila for Snehapana, Sarshapa Taila for Vishramakala in Virechana. Then we have noticed that after Snehapana and after Virechana, hypoglycemic effect and blood sugar lowering effect are noticed. And in according to Sharangadara, Madhyamakanda, Paniya Kalyanaka Grita and Shatavari Taila are told for Snehapana. When patient is having Pitta Pradhana Lakshana and Kapha Pitta Pradhana Lakshana, these Snehas can be used. In Bhava Prakasha Madhyakanda, Dhanvantara Gritam and Simamrita Gritam and Arjunadya Gritam, Arjunadya Thailam, Yamakasneham are told. And according to Vaishaj Ratnavali, Dadimadya Grita, in our clinical practice, we have endothelial or immunological side effects of diabetes. The practice of Dadimadya Grita is very effective. 5 ml early in the morning on empty stomach, if it is given, most of the diabetic complications can be prevented. Pitta Pradhana doshas can be prevented. Meham Hira Thailam and Shalmali Gritam or Simamrita Gritam or Haridradi Thailam. These are all very effective Snehapanas. They should be judiciously used by Ayurvedic practitioner. And I will tell you about some of the drug designs. Snehapana should be used when patient is having dosha in Rakta Ashrita Avastha, initial stage of the Madhumeha, then Sarshapataila is very effective in Snehapana. If patient is having Vatakafa Pradhana Avastha, Madhyama dosha Dushti Lakshana, then Snehapana with Tilataila is good. Murchita Tilataila is the understanding there. In another area where patient is having Gambira Dats are there, then Mahasneham, Grutathela Vasamajja with from the Unmada Apasmara Rogadikara should be selected for diabetes management. If patient is having Tridosha Avastha and Vatapritta Anubandhi Dosha Avastha, Bugulu Tiktakam Grutam should be used for Shodhananga and Shamananga Snehas. Like this, we can also understand what is the role of Virechana in Madhumeha Chikitsa. This Virechana is effective in management of Koshtangas. Acharya Sushrita says there are 8 organs in Koshta. Acharya Charaka says 15 organs are there in the Koshta. Costa means not simple elementary tract which is having a tubular structure. All associated organs are also one of the Costa Lakshana. So Costa Shodhana is very important in Madhumeha, and Virechana helps in Medahara Kledahara effect. Virechana is effective in Tikshna Dravyas. When Tikshna Dravyas can be used in Virechana, then Virechana Dravyas having Katatikta Rasa Pradana and even Ushna Guna Pradana, it removes Bahudrava Sleshma and Abadha Medas, and Pitta Vata dosha will be taken out from the doshas, and Dhatvagni improves, and Dhatvagni return back to its maintenance activity. So dosha dhatu normal phase starts. Because of gunas of Dravya used in Virechana, they act at microcellular level and also effective in normal physiology of the tissue levels. So Virechana directly acts on liver. Liver is important area for Bhutagnipaka and Dhatuagnipaka. And if liver is affected, the metabolism is affected, Krebs cell is affected, so glucose metabolism affected. When glucose metabolism affected, liver must be corrected. So Yakrit Odara Chikitsa and Maha Udara Chikitsa or Yakrit Dalyudara Chikitsa, Dhatvagni Chikitsa, and all the Avastha Paka, Nishta Paka Chikitsa should be considered for enzymatic activities, thereby increasing the metabolic activities. Thus, Virechana Karma helps to reduce the glucose production or glucose overcome, and also it is effective in impaired insulin secretion, or it brings normalcy in the blood glucose level, thus reduces the signs and symptoms of Madhumeha and diabetes. I will tell you some of the drug designs. Vatsanaba is one of the Vishaushadhi. It is effective in Sravana Karma. So, with the help of sodium and calcium influx into the beta cells of the pancreas, Vatsanaba is effective in treating insulin transport into the cell. So, Dhatvagni and Dhatupaka will be improved by Vatsanaba. Vatsanaba may be responsible for decrease in insulin resistance and insulin transport into the cell as Visharasayana. So powerful anti-inflammatory effect and free radical scavenging effect of Shodhit Vatsana is the Karaka. So Sravana Karma is improved. So it is reducing the symptom of stimulating saliva secretion. So glucose is increased in the saliva. So Asya Madhurya is one of the symptom of Madhumeha. When Vatsanaba is given, Asya Madhurya and glucose level in the salivary amylase will be decreased. So Vatsanaba is Balya. It gives strength to the nerves and muscles. So it is Madhura Vipaka. So Vata Shamana effect and Vata Prakopa effect will not be there. So it gives strength and reduces Daurbalya and fatigue of the patient also. In one more drug design, if Jambu Bija Churna is taken as a basic drug for Madhumeha Chikitsa, it is Ruksham, Kashayam, and it is going to decrease the kleda in the body, and it is going to improve the Madhura Rasa in the Mutra is decreased by Jambu Bija Churna. So when a patient is having Krishata, then we can think about along with Jambu Bija, Loha and Vatsanaba, Yashada Kalpa can be added. If patient is having associated with Agni Mandya, Tamra Kalpa should be added to Jambu Bija Churna. If patient is having associated with neurological problems, Abraka Basma should be added, Rajata Basma should be added to Jambu Bija Churna. If it is associated with Staulya, then Vidanga Tandula Rasayana, Vidanga Trifala Rasayana can be added with Jambu Bija Churna. If patient is having associated with Daurbalya as Lakshana, Amalaki Rasayana, Guduchi Rasayana, Loha Rasayana, see there are a lot of Loha Kalpas, Loha, Abraka, Swarnamakshika, and even Rajata Makshika, and some of the Tamra Kalpas. All these are very important Loha Kalpas, can be added along with Jambu Bija. And if patient is having stress as one of the associated problem, then Jambu Bija should be mixed with Jyotishmati and Kuchala Rasayanas. Like this, according to the need of the patient, according to the Kriya Kala of the patient, Avastha of the patient, Dhatu involvement of the patient, Dhatvagni and Mala involvement of the patient, one basic drug like Jambu Bija Churna. Alone Jambu Bija is also effective, but Jambu Bija, Jambu Patra, and now Jambu wood manufactured vessels are coming for using drinking water glasses. Like this, Jambu based drug design can be done in diabetes. I will also tell about few of the aspects of food is a medicine or food as a medicine in Madhumya. See, flax seeds are very effective seeds. They contain omega-3 fatty acids. They are rich in insoluble fiber, which helps in improving the bowel regulation, and blood sugar levels of the body will be controlled. So, roasted flax seeds, Atasi bija rasayana. Atasi bija can be used as a food, and
Sir, sorry to interrupt. Your voice is not audible, sir. Participants, I think there is some technical issue at the from sir's end, and I think he will be joining back shortly. Please be with us till that time. Thank you for your patience.
I think my audio is available. Video we will put in short time. So PPT will be presented in short. But I was telling about 5 seeds used in Madhumeha management. One of the seed is flax seed. I was telling about that. Second seed is with chia seeds, which are very effective in management of Madhumeha because of its high fiber content, and also it is very rich in omega-3 content. Next seed I wanted to tell was the fenugreek seed. Netika. Fenugreek is one of the powerful fiber seed, which is also having insulin sensitization effect is more in this. So fenugreek seeds can be used for diabetes management. And fenugreek seeds, when we use them, they are having 10 grams of fenugreek seed contains per day, have a symbiotic effect in improving the insulin sensitivity. Insulin sensitivity. I think my audio is on and I can continue. So fenugreek seeds are also effective in the management of Madhumeha because of their Tiktarasa and alkaloids, which are rich in insulin sensitizing effect and also fiber. Next is sunflower seeds. Sunflower seed is also one of the important seed. Roasted sunflower seeds are also having high fiber content, and these sunflower seeds are rich in vitamin C. Sunflower seed is rasayana. It contains selenium. It contains niacin. It contains dietary fiber and protein. It also contains folate and iron. So sunflower seeds are also one of the important area where we should use a good amount of seed. So pumpkin seeds. Pumpkin seed is also very effective in diabetes management because they are having a beneficial property in diabetes, which contains more protein, more dietary fiber, and pumpkin seed contains omega-6 fatty acids. So magnesium is also there in pumpkin seed. Like this, we want to know that the role of food is a medicine or food as medicine. We can use 5 seeds. You can make a powder of 5 seeds: fenugreek seed, pumpkin seed, sunflower seed, chia seeds, and these seeds can be mixed and used in our regular diet. You see, sunflower oil is different. Sunflower seed alone is different. The pumpkin seed and sunflower seed, when they are used, sunflower seed is having selenium, and because of this vitamin B5, vitamin E, and selenium, and also dietary fiber, folate, and iron content, there will be stimulation of insulin metabolism, reduction in insulin resistance. So I also make all the audience to use these 5 seeds in your clinical trial. Now I'll talk about one of the case study. In one of the patient, 38-year-old, Dr. Bhargav and Dr. Reddy treated this case. It is noticed that a 38-year-old male patient, newly diagnosed diabetes patient who is not on modern medicine. He was diagnosed case of Madhumeha, history of 1 month, and he came to the hospital. And in the before treatment, it was noticed that fasting sugar was 182 and postprandial sugar was 190, and HbA1c was 8.2. Patient was subjected to Deepana Pachana with Abhayadi Kashayam, Deepana Pachana followed by Snehapana with Murchita Sarshapatailam prepared by our PG scholar itself, and it is followed by Virechana with Vishala Pippali Yogam, and after that Rasayana Neelakanta Rasa with Falatrikadi Kashayam as Rasayana was given for 30 to 40 days, and it was observed that fasting sugar came to 98 and postprandial sugar came to 132, and HbA1c reduced to 5.8. This is one of the very significant case study. It will encourage the morality of treating Ayurvedic physician, Shodhana followed by Rasayana. And even we have noticed that Abhayadi Kashayam is also having Deepana, Pachana, Sroto Shodhana and Avaranagna property. And Sarshapataila Snehapana removes bacterial flora and any avarana in the Annavasrotas and Koshtangas. After Virechana, when Koshta is very Shuddhi, the Virechana will make absorption of the drug better and improvement in insulin activity in the cell. So we have noticed that patient responded very well. Significant improvement was noticed. Alone Ayurvedic drug was given, no modern drug was given. So with this, I come to the end of my presentation. The altered glucose is a phase where impaired Rakta Dhatvagni Vyapara and Raktava Sroto Moola Vyapara takes place. So Rakta Dhatu Dushti takes place, which is treatable phase of Madhumeha, and it is curable phase of Madhumeha when diagnosed on the grounds of assessment of Rakta Dhatvagni Mandajanya Ama and Rakta Dhatvagni Mandajanya Ama Dosha, and respective Ama, Meda, Kleda Lakshanas will guide us to do Samhita based clinical diagnostic markers of hyperglycemia and early Madhumeha should be taken as a clinical skill and carry home message. Glucose transport system is very new area to understand, and the role of assisting molecular transporters in carbohydrate metabolism. The defect in this is going to divert the efficacy of anti-diabetic drugs as well as Madhumeha drugs of Ayurveda in drug practice. So stress plays a major role in type 2 diabetes. Stress hormones reduce the secretion of insulin and cause insulin resistance and increase the hepatic glucose production. So if hyperglycemia is not responding to any of the anti-diabetic drug or anti-diabetic Ayurvedic drug, then treatment should be carried for Rakta Dhatu Dushti followed by Raktava Sroto Shodhana and stress management and hormone management. So to quote, we have conducted 3 researches, assessment of efficacy of Virechanottara, Negrodadi Churna Rasayana and Nishamalaki Churna Rasayana in the management of Madhumeha with special reference to type 2 diabetes. Dr. Shvetambari et al., where we focused more on diet pattern of the patient. If patient strictly follows the diet pattern and Negrodadi Churna or Nishamalaki Churna, very encouraging results with Ayurveda alone as a treatment is observed. In a double-blind ACT study on the role of Virechanottara Jayavati with Lodradi Kashaya Anupana and Neelakanta Rasa with Falatrikadi Kashaya Anupana Rasayana in the Madhumeha type 2 diabetes, where Dr. Narsaradi et al. Has worked on this, we have noticed in this double-blind study, we noticed that Neelakanta Rasa with Falatrikadi Kashaya is very effective. After the research, we are also continuing the research, and in that we are noticing that after Virechana, Neelakanta Rasa with Kataka Kadiradi Kashayam of Sahasra Yogam is also found very effective. Dr. Narsaradi et al. An open label RCT study to assess combined followed by Harishankar Rasa with Kiratati Kashaya Anupana in Madhumeha is going on. Dr. Ujjala is treated by Basti with one of the Prakshepa Dravya as Ikshwaku Churna collected in the local area of the Ballari. We are noticing that the Basti is going to improve the bacterial flora. So Samana Vayu, Apana Vayu activity and Vana Vayu activity will improve. So glucose transporters will be improved in the alimentary tract and the liver metabolism. So enterohepatic circulation and enterohepatic system correction will make improvement in diabetes management. In the next study under Dr. Nayak, it is also research is going on to work on stress management with the rasayana of Jyotishmati rasayana is taken out. Like this, the uh, role of Ayurvedic physician is very important. We have to develop our own clinical skills. So I want to divert all the practitioners' mind to some of the concepts. I have not talked about a regular class pattern of Madhumeha Chikitsa, Nidana, Samprapti, and then Chikitsa Sutra. I have not gone into that. Even though Shastra says Amedo Mutralaihi as one of the line of treatment, when we understand Madhumeha Lakshanas in Rakta Dushti Lakshanas, in an early stage before the onset of Madhumeha Lakshana and before the onset of type 2 diabetes Lakshana, it is a curable phase, it is a treatable phase, it is a Sukhasadhya Avastha. Once patient transforms from Rakta Dushti Lakshana to Madhumeha Purva Rupa or type 2 diabetes Lakshana, it is Kashtasadhya Avastha. So we should always try to focus on Yakrut and Dhatvagni Paka, Bhutvagni Paka, and Ama Meda Kafahara effect, Kledahara effect, Katu Ushna Tikta Rasayanas, Avaranagna Rasayanas, Vata must be always controlled. Pitta must be purified and Vata must be controlled. Sarshapataila controls Vata and removes Kafavrta Vata and Medasavrta Vata. So, Avarana Chikitsa, Kafamedahara Chikitsa, Kriyakala based improvement of Dhatvagni and Bhutagni by Visharasayana like Ballataka and Vatsanabha and Kuchala. These Visharasayanas are very effective when Shodhita Vatsanabha, Shodhita Kuchala, and Shodhita Ballataka are tried in the form of Sanjeevani Vati and in the form of Neelakanta Rasa. A much better results are observed. Falatrikadi Kashayam or Abhayadi Kashayam, Lodradi Kashayam, these Shastriya Kashayam should be used with Rasayanas or mineral and metal based rasayanas like Loha, Abraka, Tamra, Yashada Basma. These are very, very important when compared to a simple Tiktarasa or Nishamalaki like drugs. So we should understand the avastha of Madhumeha and then think about principles of Ayurveda like Dhatvagni, Bhutvagni Paka, Avarana, and Rakta Dushti. Stress as one of the important area of the Chikitsa, and glucose transporter mechanism, and even calcium ion mechanism. If you understand these some principles, we can do better treatment in diabetic patient. With this, I conclude my talk, and I am thankful to the organizer, Pranashakti Foundation, and also the moderator, Dr. Madam, who has taken a lot of efforts to make this presentation successful. I'm also thankful to the Kundu sir and all organizing committee members. Thank you, one and all.
Sir, we are extremely grateful. I started my session by telling that we are so grateful that you could
I think
enlighten us with such a profound concept with all your inputs, practical inputs, and the Vedic algorithms that goes into the successful management of diabetes. That is very important. And we see in the modern times still many of the practitioners, we are very much fearful about the using of the rasa medicines. Sir, do you have some time to take up the question, because it is already over time? So do you have some time to take some questions, sir?
yes, yes,
Yeah, thank you so much, sir. Participants,
yes,
sir has
we can
been
take some
very generous with
questions.
us today. Now the platform is open. You can go ahead and ask your question, but please try to keep it very short because he has a very busy schedule. And if you have any questions, you can put it in the group and we will keep the discussion on. Feel free to ask your queries. Thank you.
Sir, I have got a question.
Okay.
So this fatty liver you are referring that, okay, because of the diabetes and taking of the medicines, the fatty liver may arise. So whether I am a layman, okay, so I might not understand the language what you share. So sorry if I am interpreting it wrong. So whether it can also lead to death of a patient, is it that serious?
Okay. Very good question. Even though you are layman, it is very important to understand that 5 years back or 10 years back, when fatty liver was diagnosed by radiologists in ultrasound scan, the modern doctors used to tell that neglect it, it is not going to do anything. It is nothing. But now we are in the phase now, even modern medicines and hepatologists have come to the phase that if fatty liver is neglected, it may land up in fibrosis, necrosis, cirrhosis, and even further complications of liver failure. That's why this fatty liver may be a very early symptom, maybe due to the diabetes, or maybe due to the alcohol, maybe due to drug induced. It cannot be ignored. It cannot be neglected, is my concept. You check out with the physician and see that fatty liver can be treated along with madhumeha chikitsa or diabetes treatment. So if you restrict the carbohydrate intake, if you restrict the madhura rasa intake, and if you restrict the oil and fats intake, then fatty liver can be very well treated in Ayurveda. And we can stop further progress into cirrhosis, fibrosis, or necrosis phases. So early stoppage of these medicines can also help you to come over and think of So it cannot be neglected. It is going to be a very late stage. Then patient will have very complicated multi-organ failures.
Yeah, understood, sir. Understood. Thank you. Thank you so much.
Thank you.
Sir, I have a question. My question is that you mentioned that it is very important to incorporate the any of the procedures in Panchakarma. It can be Virechana or the Vamana. Um, so, patient in the Western countries, they may not be having the proper knowledge, or they may not be having access to the classical or the Shastriya medicines that for Sneha Pana and for all these protocols, and even they are very fearful. It is also mentioned in the Sutra Sthanam that the proper Virechanam will be 30 times excess, or 20 times, or 10 times. Even they are fearful to undergo that, or the complete bouts of the Vamana also, 10, 8, 6 times. They do it 1 to 3 times and then they stop. Sir, then how to take it ahead for especially the Western people who are showing their interest in Ayurveda for complete holistic healing of diabetes?
Very good question, madam. It is one of the boon for us. Don't worry about Western people. See, now G20 program is going on, where health tourism is promoted by Government of India. And for Ayurvedic treatment, immediately visa is given. This is one of the fantastic time that our Government of India is making easy for coming to India, and for getting treatment, visa is made easy. And for the same thing, I'll tell that as an Ayurvedic Vaidya, I should not bother about, again, Western people are afraid, they cannot come, they don't have big center. It is true. When in India, when cancer treatment was not available, what we used to do? We go to the Western countries, we pay money, and we get a treatment. Now, anti-cancer treatment is in India. Even then, our so-called richest people go to Western country. Even some of the patients import the Western medicine for the anti-cancer programs. So Vasudhaiva Kutumbakam, global village is there, and we can help. If patient is ready to take treatment, let them come to India. Let them come to a classical Ayurvedic treating person, where correctly Shodhana will be done, and in the name of Ayurveda, so many black market is going on in the Western countries, and name of Panchakarma, wrong practices are going on. We should not encourage that. As a G20 program, as a global village program, sitting in India, we can give very good service to a patient who is in Western community. Let them not afraid. Take proper treatment in a proper certified Ayurvedic Vaidya. Any certified Ayurvedic Vaidya who is Samhita based practice is done, for them Shodhana Chikitsa should be allowed. If that is not available, then they can think about only Shamana Chikitsa. As much as possible, improvement will come. So Shodhana followed by Rasayana has got a major reversal program. And if any Westerner want treatment, let them come to India with health tourism visa. They will get immediate visa now. So India is open for giving service in the olden age, and now also India is ready to treat global village people. So Ayurveda is open for treatment. I think there will be no problem for anyone in any world area can come to India and take treatment. If treatment facility is not available in their country, we cannot do adjustment Ayurveda Chikitsa. See, adjustment Ayurveda in the name of food product you are selling Ayurveda, that is not going to work. So in the name of Ayurveda, classical based, Samhita based, systemic Ayurvedic Shodhana should be done. Then there will be no complication, no fear at all. I think I have
Yes, sir. You have given the confidence. Just the last question from my end. Another thing is that in Western countries, many of them, I understood that now India, from the beginning, we have been very generous as a country. We have been always very open for the people to get the best of the resource from us. But there are section of the people in the Western countries who are working hand to mouth condition, but still they are interested for availing Ayurveda. But the herbs that are reaching there are mostly very expensive. So they are trying to use not the catalog drugs mentioned in the Samhitas and substitute it with the Western drugs. Sir, what is your overview on it? What is your understanding about it? They are using it, sir.
Very good question. This is one of the policy makers area. India is a country where flora is available. It is good for Indian national people. If this is substituted by Western flora or European flora, studies are not available. The concrete studies are not done based on Ayurvedic principles. See, herbal drug treatment is different. Ayurvedic treatment is different. In the name of herbal drug, anything is sold. Chinese medicine is also herbal drug, but that is having different principle. Yin and yang is used. But if you want to use Western plant flora, a proper research is needed. Then only we are able to do a substitute or not. Because Ayurveda is accepting science. Based on Panchamahabhuta theory, we accept everything. Because in the Bhava Prakasha period, in the Sharangadhara period, and in even Vaishyaja Ratnavali period, for 17th century, 16th century, we have taken many of the modern Western flora came to India, like Dalchini, Chokchini. They are all imported drugs and Ayurvedic drug, and even Potia. And Chokchini is a Western drug. We started using it for venereal disease. Enhance our Nigantus and Samhitas with our further modern scientific based Ayurvedic research. Like Chopachini is accepted, why not other things are accepted? The Western flora or European flora should be studied properly. Then we can think that we can use a substitute for Ayurvedic drug or those. Now Ayurvedic doctors should make themselves very fit and fine to treat Madhumeha patients in India. Then think about using Western flora Rasaushadis or Western flora Kastaushadis, and based on their research, we can do further clinical practice. Until then, we have to work on Indian flora based drugs only. Substitute is a scope for research. There is one more question. If newly diagnosed prameha is treated and found that HbA1c normal unfollowed, then how long patient need to take Rasaushadhi? Very good question. See, HbA1c is not a very perfect marker for diabetes. It is a calculated value. Fasting sugar and postprandial sugar are directly estimated values. HbA1c is a calculated value. If HbA1c, I have data that HbA1c becomes normal, but fasting sugar and postprandial sugar will not become normal. So in that case, you frequently observe the sugar levels and monitor that. Once in 3 months, hemoglobin level, HbA1c level will be tried. And once in 3 months, fasting and postprandial sugar should be checked. And if you want to give Rasaushadhi, one mandala prayoga should be done, 48 days at a stretch, followed by 1 week or 2 weeks gap. And again, you can give 48 dose second trial. And if patient is asymptomatic and blood reports are controlled, then you can stop medicine and switch on to only Kastaushadhis. And after another trial, if patient is not symptomatic, he is reversed with the newly diabetes management program, then medicine can be stopped. But Rasaushadhi at one stretch given time period is 48 days. After that, a breakup should be given. And followed by that, again, you can give one mandala prayoga. This is what we do in our practice.
Shall I ask one question, ma'am?
Yes?
Shall I ask one question, ma'am?
Yes.
Yes, sir. Please go ahead.
Okay. Doctor, namaskar. What happened now? Supposing I am under treatment by some Ayurveda Charya, some highly reputed. How can I know that he is doing the proper treatment or just makeshift treatment? As you said, some artificial type of just makeshift treatment. That is one thing. Another thing is, suppose these you told us some researchers are doing some research in your hospital. So who is the authority who certifies all these? Because sometimes when we talk to any Ayurveda Sarya, he says no, it is certified drug. This medicine is certified by the authority. So we don't know after that what to ask, which is the authority, like FDA or IMA for this English type of medicine or modern medicine. They are the apex body. So what is the apex body for this Ayurveda and this holistic healing? Can you?
Thank you,
Please tell
Narendra. You have asked two questions. First one is, every customer has got a right to know his medicines. So in a open level treatment, the customer has got a right to know what your Vaidya or your practicing doctor is giving to you. Understand? Then that is one issue. Second issue is, we are doing research under the guidelines of ICMR.
Okay. In the Council of
ICMR guidelines, we have a certified institutional ethical committee. Institutional ethical committee is the highest body to certify, gives green signal to do research. So it is authentic one.
No, I'm not talking about authenticity. Who is the apex body? ICMR, no?
ICMR.
Oh, okay. Thank you, doctor. Thank you.
Thank you.
Participants, we are just wrapping up. So any more questions? Any more questions? Sir, Kedarnath ji has posted a question, sir.
Okay, Kedarnath ji, it's a good question. How to interpret FBS, PPBS, and HbA1c in terms of Sthula and Krisha Prameha? Very nice to know that at the end of the talk, the scholar don't know what is prameha. Still, if you want to interpret a modern marker into Ayurvedic marker, whether patient is obese diabetic or patient is lean diabetic, understand? If patient is obese and diabetic, according to his body mass index, we have to calculate the dose, the sugar levels. That's why range is given. And the ranges are to be understood as per the body mass index. Number one. Number two is whether patient is obese or patient is lean. The blood sugar level is fixed. Blood sugar level fasting, blood sugar level postprandial are fixed as normal standards. When it comes to the question of HbA1c, HbA1c was thought 10 years back that it is a big good marker for understanding diabetes, where it will tell about 3 months average. But now there are some research discussions going on internationally that it is an estimated calculation and it is not a realistic estimation. HbA1c and EGFR, they are all estimated calculations. Estimated calculations are not standard. They are one type of guidelines or one type of information to understand some glucose level. I have noticed that HbA1c reduces very fastly, but fasting sugar, postprandial sugar will be very high. That's why that discussion is very different. Whereas whether it is patient is obese or lean, FBS, PPBS levels are fixed by ICMR standards or International Diabetes Association standards. Thank you. Another question is there. Sir, Addison's disease caused due to the undersecretion of aldosterone and hypoglycemia. For this disease, is there any treatment in Ayurveda? So I have talked about this in genetics and stress hormones. This acquired Addison disease, if aldosterone is abnormal, then we have to understand the patient condition. Hypoglycemia is there. This is different issue. I was talking about only hyperglycemia and management. In the today's presentation, we are focused more on hyperglycemia management. If it is hypoglycemia due to the Addison's disease, a CT abdomen or MRI abdomen should be done to know the adrenal glands status. If there is a tumor causing hyposecretion or undersecretion, that specific treatment has to be done. If there is a tumor causing hypoglycemia or aldosterone low level secretion is due to that, after treating the tumor, a stimulation of aldosterone from the respective gland can be tried. That is possible. One more question is there. In case of control of diabetes, which diagnostic criteria gives accurate update of the disease control during the Ayurvedic treatment protocols? Yes. Very good question. During protocols, we have to go by, we are giving Ayurvedic intervention. So KN Udupaji model is diagnose according to the modern parameter, give treatment according to Ayurvedic principle. And monitoring and assessment is again due to the modern protocol only. Accurate measures or disease control up-to-date measures is by modern medicine only, modern language only. The fasting blood sugar, postprandial blood sugar are currently used as best markers. But newer and new technologies are coming, like HbA1c came. Within 10 years now, discussions are going on. It may be faded, and in future, any new area will come. At present, we are following the blood glucose level monitoring only. Thank you.
It was a phenomenal presentations, and we are hoping to have another session with Vaidya Madhava Diggavi sir very soon on another topic, on another chronic disorder management, on the Ayurvedic algorithm. With I focused strictly on the classical Ayurvedic algorithms. Thank you, sir, and we offer our pranam for your enlightening sessions. And thanks a lot to all of the participants for their participation on a Sunday evening and for their wonderful questions, because whenever we ask questions, we learn more. Thank you, everybody. Thank you, everybody. And please keep posting your questions in the chat box. And when sir is free, he will be able to address, and we will also try from our end to address the same. Keep sharing and get correct knowledge of Ayurveda instead of relying on the OTC drugs or OTC model of treatment. Have a good evening to everyone. Take our pranam. Thank you, sir. Thank you so much, sir.